Good morning. I am Dr. Dipankar Banerjee speaking from Ideal Fertility, which is placed in Madhya Pradesh, Jabalpur. I am a gynecologist and fertility expert with a special interest in genetics and fetal medicine also. There is a news in our local newspaper that the females are freezing their eggs. We are doing this egg freezing since long, and freezing is a very useful and important method for those girls or those females who are busy with their career or who want to marry late, or they might not be getting their able partner. And as the age goes on, there is a fact that whenever there is, this is ovary and this ovary is full of eggs, and it is 2 million at the time of birth, and it reduces to 200,000 at puberty, and it gradually goes down. After 30 or 35 years, it goes very low whenever there is less amount of eggs. Now, if it is not used in the earlier age for reproduction, the eggs which are used in the late age for reproduction will be of poor quality and poor quantity. With this, the chances of having Down syndrome and fertility is Down syndrome become high and fertility goes down. Sometimes it goes so low that you need somebody else's egg. That means whenever you reproduce with somebody else's egg, you will not be the genetic mother. So what to do? If you are not getting married, then you can freeze your eggs at lesser age. That means whenever you feel between 25 to 30 years, or even 32 years, even 35 years, whatever may be the eggs, because they are not getting fertilized, so we can freeze those eggs. We take out the eggs, how many numbers, with a stimulation which requires some injections. This injection might go for 10 to 12 days. Then under anesthesia, without any pain, we take out these eggs outside the body. Whenever we take out these eggs are frozen, and they will maintain status quo till they are frozen. Whenever they are being used later part of the life, suppose it is frozen at 30 years and you are getting married at 37 years, and you have very poor quality eggs, not able to reproduce with your partner, then you need eggs from somebody else, which will be genetically different. But if you have frozen your eggs, you can take these eggs from your stock and can reproduce. So you will be the genetic mother, number one. Number two, because these eggs are of younger age, the chances of Down syndrome and other complications will be less. Number three, because they are from earlier age, the chances of pregnancy rate will be high. But there is a catch, there is a caveat, there is a how many eggs they are when they get warmed, how many eggs are active. So most of the time, the revival of the eggs are 80 to 90%. So if I freeze 10 eggs, I might get 8 to 9 eggs for use. So for how many years you can freeze them? It depends upon your requirement. It can be go for 2 years, 3 years, 5 years, 7 years, or 10 years, whatever it is. Another beauty is, because there is no involvement of any other partner, so it is your property. Whenever you want to use, you can use it. But if you freeze embryos, what we do, embryo freezing, and something happens to your married life or your with your partner, then the problem with the claim of the embryos becomes a little bit problematic. So egg freezing is more convenient for the female, and egg freezing is a scientific method. For that, you need an injections for making many eggs. You can make in a single attempt or two attempts or three attempts and collect eggs and freeze them. So this is the method of egg freezing, and at the time we are costing near about 3 to 4 lakhs maximum for single attempt egg freezing, and this can be kept in our center till you want it to be used later on. Thank you very much.